Hello, hope you're having a good day. In this world, there are a lot of infectious diseases such as common cold, tuberculosis, malaria, athlete's foot, etc. And today, I would like to share with you about hepatitis. I shall be introducing the basics like the causes, types of hepatitis, symptoms, treatments, preventions, and the conclusion. So I hope you have your seatbelts on because this is going to be one memorable ride for you. So, what exactly is hepatitis? Well, hepatitis, in other words, a common name for it is viral hepatitis, which means it's often caused by a virus. It is inflammation of the liver tissues. The causes can range from viral infections, alcohol consumption, certain medications, and autoimmune diseases. There are five main types of hepatitis, such as hepatitis A, hepatitis B, hepatitis C, D, and E. So, there are five known types of hepatitis viruses that have somewhat different and unique properties. First, there are hepatitis A and hepatitis E, which is HAV and HEV for short. These both are quite similar and is transmitted through the fecal oral route, or in other words, ingestion through contaminated food or water. HAV and HEV virus is almost always acute and they are essentially not chronic. Acute infection is described as though you can rid the virus from the body and usually it lasts less than 6 months, so it usually is cleared by the human body. But two differences to note though is that between these two viruses is that only HAV has the option for immunization, and HEV infection for pregnant women can be very serious and can lead to acute liver failure. Next, there is hepatitis B virus, in other words, HBV. This virus is transmitted via the blood, so it could be from sexual intercourse, needles, or perinatal, which means childbirth. HBV is mostly acute and only moves to chronic hepatitis in 20% cases overall, meaning long-term and persistent. Hepatitis C virus, in other words, HCV, just like HBV, can be contracted via the blood, so it is the routes like childbirth, unprotected sex, and others. HCV can be acute, but usually it is chronic hepatitis, is it will lead to long-term and persistent. And last but not least, there is hepatitis D, known as HDV. Hepatitis D virus is unique because it needs HBV, which means that it can only infect the host if the host also has HBV. There is co-infection, meaning that both HDV and HBV infect at the same time, and there is superinfection, which means HBV infects its host first and then sometime after, HDV virus also comes to infect the host. It is more severe than co-infection, and HDV is mainly a chronic infection. Here are some helpful websites and videos to learn from more if you're interested. Now anyway, symptoms. Are there any symptoms for hepatitis? The answer is yes. The common symptoms of infectious hepatitis include fatigue, flu-like symptoms, dark urine, pale stool, also known as feces, abdominal pain, loss of appetite, unexplained weight loss, and yellow skin and eyes, which may be signs of jaundice. But how does hepatitis get treated? Depending on which viral hepatitis, treatment options can be varied by the type of hepatitis. Hepatitis A is usually short-term and may not require treatment. Hepatitis B will require antiviral medication and monitoring. Hepatitis C will recommend a combination of antiviral drug therapies and may need further testing. And for hepatitis D and E, you should get adequate rest, drink plenty of fluids, get enough nutrients, and avoid alcohol. Now, question is, what about preventions for hepatitis? Well, easy preventions for infectious hepatitis include practicing good hygiene, receiving vaccinations, and avoiding risky behaviors like sharing needles or engaging in unprotected sex. In conclusion, by addressing the causes, symptoms, and treatment strategies, we can work towards a future free from the burden of hepatitis and improving our overall liver health. That is the end of my presentation on hepatitis. Thank you for listening. Hope you enjoyed it and learned something new. Have a good day.